Assalamualaikum warahmatullahi and good morning to everyone. Today, I'm Siti Aisyah binti Ahmad. I'm going to talk about dyspraxia. It's one of the neurological disorders in the world. Let's look at some notes that I have prepared for dyspraxia disorder. Okay, first of all, let's look at the definition. It is a neurological disorder that impacts an individual's ability to plan and process motor tasks. Another name for dyspraxia is called as developmental coordination disorder (DCD). And in UK, it states that 1% children of school age has been affected by dyspraxia, and it is very common among boys. Basically, dyspraxia is related to our motor skills like fine and gross motor skills, motor planning, and body coordination. There are some myths about dyspraxia in which it is extremely rare. The people with dyspraxia are clumsy. Actually, they are not clumsy. They because of they are unable to manage themselves properly, so they look clumsy. They are not clumsy, but they look clumsy. And the third myth is they have low intelligence. Actually, based on some research, some studies, it states that there are no connection at all between dyspraxia and low IQ. And the fourth myth is there is no cure for dyspraxia. Yes, there is no cure, but we do have some treatments and therapies to manage, to control, to reduce the symptoms of dyspraxia. So so we can so I will talk more about treatments diagnose about dyspraxia in my next slide. Next, let's look at the difference of dyspraxia versus apraxia. Basically, dyspraxia is a partial loss of the ability, while apraxia is complete loss. Dyspraxia is someone that has been born with it, but apraxia is acquired through stroke or brain injury. So it can disappear because it is acquired. It can be treated. So dyspraxia, no treatment because it is originally born like of dyspraxia. So we only can reduce the severity of the symptoms by doing some therapies that I will talk about in next slide. I'm sure you know this actor of Harry Potter movie, Daniel Radcliffe. Daniel Radcliffe has disorder of dyspraxia. Based on this article, uh, Harry Potter or Radcliffe admitted publicly for the first time that he suffers from dyspraxia, which is a neurological disorder commonly associated with clumsiness. Radcliffe said that motor skill disorder sometimes get so bad that he has trouble to complete simple tasks like tying his shoes or writing a thank you note. He said that I was having a hard time at school in terms of being crabbed and everything with no discernible talent. Based on this article again, Harry Potter said that it's the simple things that give him the most trouble. So we can conclude that dyspraxia can affect everyone with unnoticeable symptoms. So we we have to be careful and we have to take care of ourselves by doing early early screening or detection so that we can prevent the symptoms from getting worsened. For now, scientists say that there is no real cause of dyspraxia among humans. So they believe that the presence of nerve cells that control muscles, especially for motor movement, are not developing correctly. So the brain needs longer time to process data. So the scientists have concluded that these are some risk factors that may lead to dyspraxia disorder. First of all, premature birth, in which the baby born before 32 weeks of gestation. And next is low birth weight, in which the baby born with less than 1.5 kg. Next is maternal drug or alcohol use during pregnancy. For this factor, the mother plays an important role to maintain a good health state so that the baby will not get the risk of getting dyspraxia during pregnancy. Most of the time, a drug that has been used is cocaine. So next, the last risk factor is if you have a positive family history of this disorder, you as their children or progeny may inherit the disorder too. You may diagnose dyspraxia disorder by looking at medical history of the family. If the family has a positive history of having dyspraxia, so the next progeny or children may get dyspraxia also. Next, we can refer to fine motor skills, in which we evaluate how the person use their smaller muscle to try to lace doing buttons, writing, and so on. And we can diagnose on get gross motor skills in which how the person use the large muscles that coordinate body movement like jumping, throwing, walking, and so on and so forth. And there are three types of dyspraxia. First is overall, in which the person has difficulty in performing mouth and tongue movements, and verbal if the person has problems with speech, and motor if the person has difficulty in gross motor skills. In general, dyspraxia may show these symptoms like poor balance and posture, fatigue and clumsiness, poor hand-eye coordination, differences in speech, and perception problems. If you meet someone that has these symptoms, you may advise the person to go for diagnosis and treatment because early early detection is better than late. In this slide, I have prepared some symptoms of dyspraxia in children. It is important for you as parents or guardians to notice early the symptoms among them so that you can prevent earlier because prevention is better than cure. So for children, you may observe whether they have dyspraxia or not by crawling, walking, self-feeding, and dressing. These are the symptoms if the kids have dyspraxia. First is unusual body positions, general irritability, sensitivity to loud noises, feeding and sleeping problems, a high level of movement of the arms and legs. Let's go more on detail. The kids may have problems with physical movements if they show these symptoms like unusual posture, problems with fine motor skills, coordination problems, messy eating and drinking, and so on and so forth. And if the children have problems with learning, they may show these symptoms like short attention span for difficult tasks, thus problem to remember and follow instructions, lack of organizational skills, low self-esteem, immature behavior. For adults, these are the symptoms like abnormal posture, lack of confidence, balance and movement issues, poor hand-eye coordination, trouble learning new skills. Basically, all of the symptoms are related to motor skills. We know that there are no cures so far for treating dyspraxia disorder, but we do have some therapies to reduce and manage the severity of dyspraxia. So let's look at the first of all occupational therapy, in which the person in charge can help the affected person to find practical ways to remain independent and manage everyday tasks like writing and preparing meals. Next, cognitive behavioral therapy (CBT) is a talking therapy to help manage problems by changing the way he or she thinks and behaves. So, uh, by doing CBT therapy, the affected person can change the way they think about themselves. Next is, if you have if you are the guardians or parents, and you notice that your kids show symptoms of dyspraxia, you can bring them to meet and consult pediatrician at hospital, because pediatrician knows more about your kids' progress. So next, people with dyspraxia have to keep healthy and fit by doing more physical activities in order to improve and enhance their motor skills movements. Uh, in, in addition, they also can help to improve their body coordination, to reduce feeling of fatigue and prevent weight gain. Last but not least, they can go for team support like Dyspraxia Foundation, in which most of the members are, are having dyspraxia, so they can share their feelings, their problems, and they at least they have someone to talk to uh, about their condition. So they also can go for counseling to get some advice, to get some tips in order their to manage themselves in a good manner. As you can see here, the kid has been diagnosed with this condition. They may struggle with posture and balance. In fact, they may seem out of sync or even clumsy. That's why the person or the or kid with dyspraxia looks clumsy, because they are unable to manage themselves. So this picture shows that people with dyspraxia has problem to shoelace their shoes. And this picture shows that dyspraxia among teenagers. These are the references that I use to find information to complete my presentation. That's all from me. Thank you. If you have any questions, feel free to ask me. Thank you.